Hello, Bundabugio team. It's good to be back with you, and I have just one last video on peptic ulcer disease and GE reflux to share with you. I think you'll find it interesting, and it's an important part of taking care of patients with those conditions, which are common actually where you are and also common where we are. Hope you enjoy this video. I'll talk to you at the end. We've been talking about acid reflux disease, how acid flows up from the stomach into the lower esophagus and causes pain and sometimes pressure and shortness of breath and acid rash in the back of the throat. Today I would like to talk to you about how lifestyle can affect acid reflux disease and even peptic ulcer disease in general. Lifestyle turns out to be actually very important for these conditions. We in America don't like to change our lifestyles. We like to keep the same lifestyle and do what we want. And instead, we seek other kinds of treatments instead of changing our lifestyle. We particularly are fond of using pills instead of changing our lifestyle. We'd much rather take a pill than do what is actually good for us. This is a common thing in our culture, and I suspect it might be present in your culture as well. It turns out that there are actually 7 things which are particularly important in lifestyle which can affect reflux disease or peptic ulcer disease. So in this video, I want to focus on those 7 things so that you'll be able to talk to your patients and get a history of whether or not those 7 things are having an impact on their problems. The first 4 things are the most important, and we'll go over them because they are very important. Now, I've already told you about the most important one, and that is taking anti-inflammatory medications like ibuprofen or aspirin or naproxen or other drugs in this class. We talked before about how these drugs take away the protective mucin in the stomach and also in the esophagus and allow ulcers to form and reflux to produce problems. The second most important lifestyle factor is tobacco use. Tobacco use it has a powerful influence on the stomach. The nicotine increases acid production and reduces blood circulation to the stomach. In that way, causes difficulty again with reflux, with ulcers in the esophagus, or ulcers in the stomach. It is very important. The third most important factor is alcohol intake. Alcohol is also a powerful acid stimulus in the stomach. And so it is very important to find out the history of alcohol intake in a patient who is having difficulty with stomach pain and also symptoms of reflux. Now, this alcohol can either be home-brewed alcohol, or of course it can be alcohol which is purchased and is much stronger. The fourth factor, and what I call the big 4, is caffeine intake. And this can be caffeine from coffee, or it can also come from soda and energy drinks. Caffeine is also a powerful acid stimulant in the stomach and can definitely cause trouble. So when you're dealing with these patients who are having abdominal and epigastric pain, you should be checking to see if they're drinking coffee or energy drinks or just plain sodas that have caffeine in them, such as Pepsi and Coca-Cola. Those can cause lots of troubles. Oftentimes, if you can just get a patient to stop smoking and move away from coffee, you can solve a lot of their problems. We say if you want good health, you should not drink your calories, but instead you should eat. Now I want to tell you about the last 3, which are not quite as important as that first 4 I told you, but also should be taken into consideration. The first of the last 3 is eating spicy foods. Eating spicy food stimulates reflux and ulcers as well. So one must be careful if you're having symptoms about eating spicy foods. The second one of the last 3 is eating large meals. If you eat large meals, your stomach will overfill and the contents of your stomach will easily spill up into your esophagus, burning it and causing problems in the esophagus. Here's the last one. If you eat big meals, late at night, you will particularly tend to have troubles. This fellow is late at night eating a very large meal, and it will not be good for his stomach or his esophagus. Sometimes we laugh about this, but it's easy to do. I'm going to show you a funny picture at the end where his head has been reversed with his big meal. He's not using his head to think. He's only thinking about food and not his health. So the point is about eating a large meal late at night is that if you eat that meal and fill your stomach up and then lay down, that acid in food is going to run up the esophagus and burn the esophagus and cause troubles there. So that's why it's important not to try and eat a large meal late at night, because that can contribute to GE reflux disease, what we sometimes call GERD for its acronym GERD, GE reflux disease. So I hope that's been helpful today, and this will probably be the last video on that topic. We'll move on to some other topics as we go forward. Been thinking about you and been praying for you, and just very appreciative of the work you do to care for the people there in Uganda. God bless. Love you much. Bye.